Welcome back to my channel, health enthusiasts. Today, we're diving deep into a topic that's crucial for your overall well-being: vitamin B12 deficiency. B12 is an essential nutrient that plays a vital role in various bodily functions, from energy production to nerve health. Many people don't realize they're deficient in B12, and it often goes undiagnosed. So, in this video, we'll explore 10 warning signs of B12 deficiency you shouldn't ignore. One of the earliest and most common signs of B12 deficiency is number 1, memory loss. You might find yourself forgetting things more often, struggling to concentrate, or experiencing brain fog. Vitamin B12 is vital in providing cofactors that form myelin. This is a protein that is essential in forming the myelin sheath that protects your spinal, cranial, and peripheral nerves. A lack of protective covering can cause damage to these nerves, resulting in neurological problems. B12 deficiency can also lead to nerve and brain damage. This damage may manifest in symptoms such as brain fog, memory problems, fatigue, depression, muscle fatigue, and tingling in the extremities. In the long term, this damage can become irreversible. This happens because B12 is essential for maintaining healthy nerve cells and the myelin sheath, which protects your nerves. When B12 levels are low, these nerves can't function optimally, leading to cognitive impairment. Recommended doses for adults, aged 19 to 64, are about 1.5 micrograms a day of vitamin B12. If you're experiencing memory problems, especially if you're younger and don't have any other risk factors for dementia, it's worth getting your B12 levels checked. Number 2, heart health. You might not associate B12 deficiency with heart health, but the two are closely linked. One symptom that often raises a red flag is an irregular heartbeat, whether it's heart palpitations or a feeling that your heart is racing. B12 plays a role in the production of red blood cells, which carry oxygen throughout your body. When you're deficient in B12, your red blood cell count can drop, leading to a condition called megaloblastic anemia. This can put extra stress on your heart as it tries to pump enough oxygen-rich blood throughout your body, resulting in those irregular heart rhythms. Macrocytosis associated with vitamin B12 deficiency is also associated with fatal and non-fatal coronary disease, myocardial infarction, stroke, and other circulatory health problems. Number 3, headaches. Headaches are incredibly common, and we often attribute them to stress, dehydration, or lack of sleep. But did you know that B12 deficiency can also manifest as persistent headaches? These headaches can range in severity and location, and they might not always respond to over-the-counter pain. According to a 2020 study, headaches were the most common symptom of vitamin B12 deficiency in adolescents. Other research shows that vitamin B12 might help treat chronic migraine. The exact mechanism behind B12 deficiency-related headaches isn't fully understood, but it's believed to be related to the nerve dysfunction we discussed earlier and anemia. If you're experiencing frequent or severe headaches, especially if they're accompanied by other symptoms on this list, don't hesitate to talk to your doctor about getting your B12 levels checked. Number 4, movement and coordination problems. Another sign of B12 deficiency that you shouldn't ignore is difficulty with movement and coordination. You might feel unsteady on your feet, experience numbness or tingling in your extremities, or have trouble with balance. This is because B12 is crucial for maintaining the health of your nervous system, which controls your movements. Severe vitamin B12 deficiency may result in chorea, myoclonus, tremor, and dystonia. These manifestations, possibly a result of basal ganglia dysfunction, are rare but important to recognize as they are largely reversible with supplementation. When B12 levels are low, the nerves that send signals from your brain to your muscles don't function properly, leading to these movement problems. Low B12 can also affect coordination, balance, and fine motor skills if it causes damage to the nerve cells. If you're experiencing any of these symptoms, it's essential to see a doctor to determine the underlying cause. Number 5, muscle weakness and fatigue. Feeling weak or easily fatigued is a common symptom of many health conditions, but it can also be a sign of B12 deficiency. You might notice that you have less strength than usual, find it difficult to perform everyday tasks, or experience muscle soreness. This muscle weakness is directly related to the role of B12 in energy production. B12 turns the foods we eat into usable energy by breaking down the glucose in carbohydrates into ATP, a molecule which fuels our cells with energy. So, it's not the actual vitamin that gives you energy, but rather it's that the vitamin releases energy for your body to use. When you're deficient in B12, your cells don't receive enough energy, leading to muscle fatigue and weakness. Also, if you're low or deficient in B12, you'll likely feel fatigued because your body's cells need B12 to function properly. As such, having inadequate B12 levels can decrease normal red blood cell production, which can impair oxygen delivery. Without enough red blood cells, your tissues and organs don't get enough oxygen. Without enough oxygen, your body can't work as well, leaving you feeling fatigue all the time. Number 6, vision problems. Vision problems can be alarming, and B12 deficiency can actually affect your eyesight. One possible symptom is blurred vision, which can range in severity from a mild blurriness to more significant vision impairment. This occurs because B12 deficiency can damage the optic nerve, which transmits visual information from your eyes to your brain. This damage can lead to a condition called optic neuropathy, which can cause blurred vision and even vision loss if left untreated. Also, lack of vitamin B12 in the body can cause serious dry eye issues and eye pain. It damages the corneal nerve layer. Oral vitamin B12 supplements and artificial tears can improve the issue of dry eye syndrome. If you experience any sudden changes in your vision, it's crucial to seek immediate medical attention. Number 7, yellowish skin. Have you noticed that your skin has taken on a yellowish discoloration? While there are other medical conditions that can cause this yellowish discoloration known as jaundice, B12 deficiency is one possible cause. This yellowish discoloration of the skin and eyes occurs due to the buildup of bilirubin in the blood. In B12 deficiency, the production of red blood cells is impaired, leading to an increase in bilirubin levels and the development of jaundice. A vitamin B12 deficiency can cause a lack of RBCs or megaloblastic anemia, which has an association with jaundice. This type of anemia can also weaken RBCs, which the body then breaks down more quickly. When the liver breaks down RBCs, it releases bilirubin. Bilirubin is a brownish substance that gives the skin the yellowish tone that is characteristic of jaundice. Number 8, depression. Mental health is just as important as physical health, and B12 plays a role in both. One surprising symptom of B12 deficiency is depression. B12 is involved in the production of neurotransmitters, including serotonin and dopamine, which regulate mood. When B12 levels are low, these neurotransmitter levels can become imbalanced, contributing to feelings of sadness, hopelessness, and loss of interest in activities you once enjoyed. If you're struggling with depression, it's essential to talk to a mental health professional. Number 9, nausea, vomiting, and diarrhea. Vitamin B12 deficiency can affect the digestive tract. A lack of RBCs means that not enough oxygen reaches the gut. Insufficient oxygen here may lead to a person both feeling and being sick. These symptoms include nausea, feeling sick to your stomach, and vomiting, heartburn, abdominal bloating and gas, constipation or diarrhea, loss of appetite, and weight loss. An enlarged liver is another symptom. Number 10, pins and needles. One of the more alarming symptoms of B12 deficiency is the sensation of pins and needles in your hands and feet, also known as paresthesia. This tingling or prickling sensation is a sign of nerve damage, which can occur when B12 levels are low for an extended period. The myelin sheath, which protects your nerves, deteriorates without sufficient B12, leading to nerve dysfunction and these uncomfortable sensations. If you're experiencing pins and needles, it's crucial to see a doctor to prevent further nerve damage. So, there you have it, 10 warning signs of vitamin B12 deficiency that you shouldn't ignore. Remember, early detection and treatment are key to preventing serious complications. If you're experiencing any of these symptoms, don't hesitate to talk to your doctor about getting your B12 levels checked. Taking a simple blood test can provide valuable insights into your health and help you get the treatment you need to feel your best. I hope you enjoyed today's video. If so, hit that like button and subscribe for more up-to-date health advice.